This is Sarah Ewert, and I'm going to do my final assessment video. I'm going to scan the environment.
Hey,
That's my patient.
Hey, Willow's over here.
We have a baby. So if you hear barking or something tugging on me, if I trip over something, it's that dog. Here's my environment. We're in the kitchen. All right, I'm going to set the phone down. All right. Is that good angle? I think it looks good. All right. I will first wash my hands with hand sanitizer.
I don't want any, thank you, though.
Alrighty. I will also gather my equipment in organized fashion. I have gloves, stethoscope, tongue depressor, pen light. I have a Rosenbaum chart, nothing on it. Alrighty, let me pull my bench up a little closer. Okay, I introduce myself. Am I in the camera? Okay. I introduce myself. I am Sarah. I will be your nurse today.
Yay!
Who are you, Miss
Lainey.
Patient?
Sorry.
Alright, and then how old are you?
21.
And what is your ethnicity?
Caucasian.
Alrighty. And then what brings you in today?
I'm just getting a basic head-to-toe assessment done.
Sweet. Alrighty. And then I've already checked my vitals. The vitals include temperature, pulse, heart rate. I think those are the same thing. Blood pressure, O2 stat, height, weight, and then pain rating. Are you in any pain today?
Probably a 0 out of 10, so no.
Alrighty. And how many teeth do you have?
You can count them if you want.
Alright, I will be counting them when I get to the mouth area.
Okay, that's fine. They might be right in the back.
Alrighty. So I am now going to observe your overall appearance for hygiene and skin color. You appear to be clean. You match your stated ethnicity. You appear your age, or your stated age of 21.
Mm-hmm.
I'm going to observe your overall body nourishment and stature. You appear neither obese nor emaciated. When I had you come in before the video, I assessed and observed your gait, your mobility, your posture, and your balance. You appear to have full range of motion, no involuntary movements, deformities. I did not see you use a mobility aid.
No, I didn't.
I have noted your ability to hear, speak, and comprehend. You are able to follow my lovely basic instructions.
Yes.
I have observed your speech for articulation and voice quality. And then what's your native language?
English.
Sweet, me too.
Yay.
Alrighty.
Easy.
And then I'm now going to assess your levels of consciousness and awareness. Your name is Lainey.
Yes.
What time is it?
It's about 12:30 a.m.
Lovely time.
Yeah.
And then where are we?
We're at a house.
All right, and then you are alert and aware times 3. I have noted your mood and affect as calm. Your behavior and dress is appropriate for the setting. I will now observe your head and face. I am going to inspect and palpate. I'm going to inspect and palpate your skull for contour, symmetry, tenderness, and deformities. Let me know. Actually, I have to put my gloves on first.
Oh, yeah.
She might have nasty hair.
Oh!
All right, let's see if I don't tear them this time. I'm really good at ripping gloves, putting them on. It's a talent.
I like your telly tie.
Wait, what?
Your telly tie? What do y'all call them?
Ponytail?
Telly tie.
All right, let me know if any of this hurts.
Okay.
Did any of that hurt?
No, it didn't.
All right, and then I felt no deformities and she was symmetrical. I'm now going to inspect your hair.
Okay.
Their color, texture, distribution, and cleanliness.
Okay.
Alrighty. Her hair is brown. It is evenly distributed.
I literally would pay someone to play with my hair.
Dude, I'll braid your hair when we're done.
Really?
I really
Okay,
good at braiding.
yay. Can you do
It
two
is
braids?
evenly distributed. It is clean, smooth texture, straight. I'm now going to inspect and palpate your skin for surface characteristics, color, temperature, texture, moisture, and tenderness. Let me know if any of this hurts. Any of that hurt?
No.
All right, her skin is pink, smooth, warm, moist, all of the lovely things.
Like a facial.
Yeah.
I was like, huh.
All right, I'm now going to palpate your temporal pulse.
Okay.
And I am measuring it for presence, amplitude, regularity, and equality. Oh, it's strong.
Really?
Yeah. All right, it is present bilaterally
Oof.
with equality and regularity, and it has a 2+ amplitude.
Good. That's normal.
I'm now going to inspect and palpate the bony structures of your face. I'm going to sit down because I don't like standing. For size, symmetry, and tenderness, let me know if any of this hurts. Can the camera see me? Yeah, it can. All right, did any of that hurt?
Mm-mm.
All right, and it is...
It's a good idea to sit down.
I know, those feet hurt. All right, and they were a good size and no tenderness, and they were symmetrical.
Yeah.
I'm now going to palpate your TMJ for crepitus, range of motion, and tenderness. Let me know if this hurts. All right, she can see me. All right, I'm going to have you open and close your mouth. All right, and then jaw from side to side. That hurt at all?
Mm-mm.
All right, it had full range of motion, and I did not feel any crepitus. I'm now going to palpate her masters. Is that what they're all teeth? Same. Yeah, they like the same thing.
Yeah.
All right, I'm going to have you clench your teeth. All right, and that was assessing cranial nerve 5. And now I am going to assess your cranial nerve 7 by having you smile, frown, scrunch your eyes, raise your eyebrows, and puff out your cheeks.
I kind of memorized it now.
I know. We've done this so many times. You will not believe.
Yeah, it's like kind of crazy.
All right, I'm gonna do vision now with my lovely chart I showed you in the beginning, the Rosenbaum chart.
The Rosenbaum.
I'm gonna have you hold it 12 to 14 inches from your face and cover one eye. Can you read the smallest line?
Yeah, 374258.
All right, switch.
I'm gonna read it backwards because I'm in my mouth.
Yeah.
852473.
All right, then both eyes.
That's kind of blurry. 374258. I'm just gonna say someone because it was kind of blurry the second one.
Alrighty. Her vision is 20/30 in both eyes.
Woohoo!
Yay! And that was cranial nerve 2. I am now going to inspect her. Can you see me? I never know if you can see me or not. Oh yeah, just let me know if I'm like out of camera.
Okay.
I am now going to inspect her eyebrows and eyelashes for color, distribution, cleanliness, symmetry, all of the hair things. They are brown, they're symmetrical. Eyelashes and eyebrows are evenly distributed. I'm now going to inspect your eyelids for symmetry, position, closure, blinking, and color. Her eyelids are pink, they're symmetrical, proper position, quirky. And I've seen her blink multiple times and she's able to close them. I'm now going to inspect her sclera and conjunctiva.
I think that's it.
I knew what it was. She wasn't helping me.
Yeah.
She did help me.
Well, she said you don't have to pronounce it right.
Okay.
So you're good.
And I am looking at it for color and clarity.
Yeah. Okay.
I'm gonna pull your eyelids down. If you want to open your eyes, look up. All right. Look down. All right. Her conjunctiva.
Yeah, good.
That was completely wrong. Was
That was
pink.
good.
Her sclera was white, so appropriate for those kind of things. I'm now going to look at her cornea for clarity and lesions. I'm going to be looking that way, so I'm going to see some side. I'm going to check the other eye. All right. Her cornea is clear, and I saw no lesions. I'm now going to look at your iris for shape and color. If I can see your eyes. They are round and blue. And now I'm going to assess, I'm now going to assess her peripheral vision. So I'm gonna have, can we see me? Yes, we can. All right, I'm gonna have you cover your right eye. All right, let me know when you can see my fingers.
Okay.
I'm too close.
You're good. I can see them.
Move it from this side.
Okay. Okay.
All right, then switch.
Okay.
Can't look
Oh,
up.
sorry. Okay. Okay. It's like a bird.
I know.
Okay.
There's like a Tweedledee.
Okay.
All right, her peripheral vision is intact. That was assessing, oh my god, cranial nerve 2. I'm now going to inspect the symmetry of eye movement in the 6 cardinal directions. I'm going to use my pen light.
I love the color.
I know, it's green. It's like the color of the fanny couch you're on.
Yeah.
All right,
Cute little
so if
thing.
you follow this with just your eyes, not your head. Alright.
That kind of hypnotized
So I
me.
did the 6 cardinal directions, and that is assessing cranial nerve. I know we do. 3, 4, and 6. All right. I just leave the pen light. Why did I think I didn't need it? I am now going to assess your corneal light reflex. I'm going to shine this right in the middle, and I am checking for presence and symmetry of her pupillary response. Looks good. All right, now I'm going to assess parva. So I'm going to assess for direct pupillary response, consensual reaction, and accommodation. So I'm going to have you look at the pretty bird of a picture. Pretty, what? I had a stroke.
Pretty bird.
Pretty bird. All right, and I'm going to have you look at that, and I'm going to shine this in. And I'm looking at her other pupil while I'm doing that, and this is looking at reaction to light and accommodation. I'm now going to have you look over there, and then look at the pen light. And look over there, and then look at the pen light. All right, and that is checking, I don't know what that one was checking, but that was one of them. And that, that was peripheral.
It was checking
It was like
something.
consensualization or something like
Yeah,
that,
yeah,
but that doesn't
consensual.
sound right.
Oh no.
Yeah,
You
and then
did
that
so.
is cranial nerve 3.
Good.
All right. I'm now going to move on to your nose, let's do the nose first.
Okay.
I am going to look at your nose for symmetry, or your nose and your septum for symmetry. They are symmetrical. I'm going to inspect your nose for patency, foreign bodies, and discharge.
Watching your favorite show.
Oh, it's my mom.
That's sweet.
She's probably watching Westworld. It's my favorite show.
I think it's sweet. It's already lovely.
Alright, I don't see any lesions or foreign bodies or discharge. I'm going to palpate your nose for tenderness. Does any of this hurt? Alright, there's no reported tenderness. I am going to inspect her nose nares for moisture, tissue color, swelling, and lesions. Let me check one more time. Alrighty. They're pink color. They're pink and moist, with no lesions or discharge or swelling that I saw. I'm gonna assess your nair patency. So you're gonna cover one nair, and then breathe, and then switch. All right, they are patent, and I'm going to inspect your ears. Let's stay on the head. All right,
Yeah.
so I am gonna look at your ears bilaterally, and I'm looking for alignment, position, size, shape, symmetry, intactness, and skin color. They are symmetric, intact. They are a pink color. They look good. Now I'm going to look at the auditory canal for lesions and discharge. All right, I don't see any discharge or lesions. Now I'm going to inspect and palpate your ears and mastoid area for tenderness or irregularities. Let me know if this hurts.
Okay.
I did the ears, and now I'm palpating the mastoid area. Did any of that hurt? And then I palpated no irregularities. And now we are going to assess for your intact hearing, which is cranial nerve 8, using the whisper test. Ooh, yeah. All right, ready? I'm gonna whisper in this ear, and I want you to repeat what I said.
Okay. 5, 5, 5.
All right.
Dog, cat, chicken.
Beautiful. I give her an A+. If only the patient's got a grade.
I know, right? Be doing good.
All right. We are now going to examine your mouth and oropharynx.
Okay, I just think.
I just got a lovely look into your mouth. It already looks beautiful.
Oh, well, it kind of looks yellow because one, I have a white in my teeth. 2, I just had a cheddar cheese biscuit.
Oh
I
yeah,
can't
she has Red Lobster biscuits. Just saying, like.
Let me show her. Hang on.
Okay, I am going to inspect her lips, buccal mucosa, and
Make
gums
dinner.
for color, symmetry, moisture, and texture. They look to be pink, smooth.
I need to show her.
They look good. I'm going to inspect your teeth for number, color, position, alignment, and hygiene.
I made this
I'm
tonight.
gonna yell at my patient to sit back down. Alright, so I'm gonna look in your mouth, and I am looking for number, color, position, alignment of your teeth. Go Alright, her teeth are white.
Yeah.
Yeah, they're appropriate for the color. They're not like green.
Oh, good. I hope not.
They are in an appropriate position and alignment. I am also going to go back in there to inspect for her soft and hard palate.
Okay.
And the floor of her mouth. And I'm looking at for odor, color, lesions, any type of irregularities.
Yeah, actually, can we laying down doing this?
Can she still? I mean, you can if she can see you.
I don't know. I'm gonna set up.
Okay. Go All right, I'm looking at the soft and hard palate. Lift your tongue out. That looks good. All right, is all the appropriate color. I did not see any lesions. Her breath smelled like Red Lobster biscuit. I'm going to now inspect her uvula
Yeah, I love
movement
popsicles.
and her pillar movement. And I am going to use a tongue depressor.
Popsicle stick.
Popsicles. If only they had the jokes on them.
I know.
All right.
Okay, well, you're not saying it too far out because my throat's hurting.
All right. Stick it up. Stick it up. All right.
I don't have tonsils.
Her movement was good, and her gag reflex was intact. That is cranial nerves 9 and 10. While I was in there, I also looked at her tongue for symmetry, movement, color, and characteristics.
When I take
It was all looking good.
Adderall, it makes my tongue look weird, like patchy and stuff. But not today.
Yeah, it looked okay when I was in there. Her tongue was pink. It moved around. I'm also going to have her do some more tongue movement stuff. I'm going to have you stick out your tongue. Left. Right. And then I'm going to have you push out each cheek with your tongue. What's that in your mouth? There you go. And then other cheek. All right. And that is cranial nerve 12. All right. What else do we have to do? All right. I'm going to have you just like swallow some saliva. Or you have water. Yeah. And that is, I saw it swallow.
Yeah.
That was 5, 7, 9, 10, 11, 12.
That's a lot of cranial nerves.
That is a home run. All right, I'm also going to palpate all of your lymph nodes. Oh, maybe scoot up a little bit. All right.
You really like to get to the end.
I like really butcher the pronunciation on like 90% of these, so I'm so sorry.
It's okay.
All right, maybe put your hair behind your ears.
Oh, cramps.
Oh, heartburn.
Wait, am I supposed to put them my shirt.
No, that's for the neck one.
Sorry.
All right. I have the pre-auricular. I have the post-auricular. I have the occipital. And then the tonsillar, submandibular, sublingual,
Ooh.
and submental.
Oof.
They are all, did any of that hurt?
No.
So it didn't hurt. They were not, they were non-palpable. There's no redness in like the area. No edema, no mobility, because they're not palpable. We are now gonna go to neck and shoulders.
Oh, I'm so cold.
I know, I'm so sorry.
It's okay.
Here, I'm gonna undo your drawstring on the back, is that okay?
Yeah.
Did you redo it? I thought I did it like a lot
Oh.
tighter earlier.
No.
If you want, you can like put the blanket over your back, or if you want to
Oh my gosh.
switch it around.
Yeah, okay.
It's up to you, because I'm not doing your back yet.
Let's do that.
Alright, so while she's doing this, I'm going to inspect her skin for surface characteristics, color, symmetry. Everything looks symmetrical.
Oh, you mean like I can do like this? Like,
Yeah, like however you want to do it, like
that's better.
preserve your modesty. I'm going to inspect and palpate her trachea for position, symmetry. Did any of that hurt? And I don't see any lesions. I'm going to inspect and palpate her thyroid. It's not enlarged. It doesn't visually look enlarged.
Nope. I don't have any thyroid problems.
And I'm going to inspect and palpate your neck for movement, tenderness, and lesions. Let me know if any of this hurts.
Nope.
Any of that hurt? All right, and then there are no lesions. She said it wasn't tender. We are now going to do active range of motion.
I don't like that.
I don't either. I am going to have you look up, look down, look to the left, look to the right. You're going to do all your head around. All right, and can you do your ear to your shoulder, ear to your other shoulder? I think that was it for those. So did any of that hurt while you were doing it? All right, none of it hurt. So, and no tenderness. I'm now gonna palpate your carotid pulse, or carotid. And I am assessing for presence, amplitude, equality, and regularity. I don't want her to pass out, so I'm not gonna be doing this bilaterally. We do it one side at a time. All right, are you ready, Miss Patient? All right. She's strong. Alrighty, so they are present at a +2 amplitude. And I am now going to palpate all of the neck lymph nodes, the cervical lymph nodes, for size, tenderness, redness, edema, and mobility. Are you ready, Miss Patient? I think I'm gonna miss some of these, but
I'm not ready.
I'm gonna get on my knees. Don't mind me. Don't mind me. I'm gonna pull your hair back just a little bit.
Okay.
All right. So we have our. Can you still see me? Yeah.
You can see better.
We have the anterior cervical chain, which is up here, and the posterior cervical chain. I have the supraclavicle. And then I have I'm gonna scrunch up, and then the infraclavicle.
Good.
Did any of that hurt? And I did not palpate anything, so they're non-palpable. There's no edema in the surrounding area, no redness. Looks good. Oh, almost done, Miss Patient, with your neck and shoulders. I'm gonna have you push up on my arms. All right.
Oh wait, that was bad.
Do you want to do it?
Yeah.
All right, and that is cranial nerve 11.
Good.
And that was like a 5 out of 5 for muscle strength.
was good.
We are now going to do your upper extremities, which luckily are already exposed. I'm going to inspect your arms and hands for surface characteristics, color, for symmetry, deformities, or any type of limitation in mobility. Her arms are pink. They are smooth, symmetrical. Yeah, they're symmetrical. Doesn't look like she has any like deformities or anything that could like cause limitations of mobility. I'm now gonna palpate her upper extremities for temperature, texture, moisture, or tenderness. I'm gonna just let me know if any of this hurts. Any of that hurt? All right, and they are warm, soft. They have a pink color. I don't know if I already said that. I just want to make sure. And while I'm there, I'm also gonna palpate for any type of edema. No edema. And I am also gonna inspect for clubbing. So I'm gonna have you put your nails together. Alrighty. And there's no clubbing. Looks like a heart.
Yeah, it does.
I'm also gonna inspect and palpate her nails for shape, contour, consistency, color, thickness, and cleanliness. This is your other hand too. And while I'm here, I'm also gonna do capillary refill, but I'll verbalize when I'm reading that. Her nails are clean. They have appropriate contour. They're all consistent in like their shape and coloring, which are pink. I'm now gonna palpate for capillary refill. I'm gonna do each nail. I'm gonna do both at the same time. I'll be quick.
That's fun.
Sweet. All right, and for each nail, the capillary refill was less than 2 seconds. And I'm also gonna inspect for turgor, which I actually watched a video. You can do it like this on the finger, and then it'll tent, which it did not tent. So her skin
that's
is.
neat.
I know, yeah, because then like you don't have to like pinch the hand.
That's nice.
Her skin is elastic and there's no tenting. And I'm now going to do range of motion in your arms, which is always fun. So I'm gonna palpate your joints during passive range of motion. And I'm looking for crepitus, tenderness, and any type of movement limitation. So let me know if any of this hurts. So I'm gonna have you roll your shoulders. This is active, yeah. All right, so roll your shoulders. I'm gonna palpate.
I'm sore.
You're sore? Oh, did you work out earlier?
Yeah.
Of course. All right, so roll your shoulders. This is passive first, by the way. I don't remember. I'm sorry. Okay. Oh yeah, she had a shot earlier. So I mean, that's where the tenderness is coming from. It's not like a joint thing. All right, so roll, and then I'm gonna have you. I'm gonna feel your arms. And then I'm feeling her fingers. I know, it's almost like a massage. Yeah. And I'm just gonna repeat the same thing on the other side. I don't know if I'll be covering her. Oh, I'm sorry.
No, it's probably good. I need to work it out.
I think they say you're supposed to move around a bunch to get like the blood flowing after your first shot. All right. Did any of that hurt?
No.
All right. And I felt no crepitus or any like limitations in her movement. Now I'm gonna do her active range of motion, so I was gonna have to repeat what we just did. So you want to go back, forward,
inside,
side, and then bend your elbow, and then wiggle all your fingers and your wrist.
Okay, I think
yeah, and just like do the same thing, front, back, side, and then elbow, and then wrist, and then fingers. All right. Did any of that hurt?
No.
All right. So nothing hurt. She did everything, moved the same way as during passive. Now I'm gonna test her muscle strength. Wow. So I'm gonna have you hold your arm like this. All right. Try to resist me pulling.
Okay.
All right. Resist me pushing. All right. And then I'm gonna have you squeeze. She almost broke my fingers. Everything was 5 out of 5 in regards to strength. Almost done. And now I'm going to palpate her brachial and her radial pulse. I'm looking for presence, amplitude, equality and regularity. And I'm going to measure these bilaterally.
Getting on the flow.
Yeah. All right. Oh, yeah, those are strong.
Really?
Yeah. All right, so they are present with +2 amplitude, and they occurred. Oh, she's strong for both radial and brachial. I am now going to assess.
I'm about to beat out of here.
I'm going to inspect her anterior chest.
Are you on that?
Not yet.
Not yet.
I am looking at her appearance, color, configuration, and symmetry. And while I'm looking, I'm also looking at her pattern and effort of breathing, which is at ease and unlabored. I'm also looking for any retractions, sighing, and paradoxical movements, of which I see none in regards to her breathing. And I'm looking for any pulsations, heaves, lifts, or thrills. And I also see none of those. So that's A+. I'm now going to palpate your bony structures, including your clavicle, your sternum, and your ribs. Don't mind me, Miss Patient. Her ribs are symmetrical, same with her clavicle. And I am going to palpate the apex of her heart, looking for any note irregularities and the presence of her apical pulse. So I might have to go underneath a little bit. Do not mind me. So sorry. Do you want to lift up? I'm going to go with your heart.
Oh.
You want to lift up a little bit so that way I'm not coughing the fuel.
No, I don't care.
Dude, it's so strong.
Really?
Yeah.
Why's my body doing this? Probably the biscuits.
She's over high. Yes, always the Red Lobster biscuits.
Yeah.
It had 2+ amplitude. All right, now we get to auscultate.
Oh, I get to lay down?
No, not at your abdomen. All right, so I'm gonna auscultate your anterior chest wall over the 8 points just to see what your lungs are. I'm looking for long clarity and advantageous noises. I'm gonna tell you to breathe in during certain points, so
just take a breath.
Don't mind me.
Okay.
All right. Can she see me?
Mm-hmm.
Yeah. All right, breathe in. Breathe in. All right, I'm just gonna go under a little bit.
I'm gonna get stuck.
All right. Her lungs sounded clear and I heard no adventitious noises. I am now going to auscultate her heart noises over the 5 points, and I'm going to do that with both the bell and the diaphragm. I'll let you know when I switch. Are you ready, Miss Patient? I'm going to do with the diaphragm first. And I'm listening for rate, rhythm, and any extra noises. Alrighty, so this is the aortic. And then I'm going to the pulmonic, or was it switched? So aortic and then pulmonic. I think I had those switched. Mm-hmm. And then pulmonic, and then Ebbs point, herbs. It's a weird name on that one. All right, I'm gonna go a little bit lower, and that's for the tricuspid. I'm gonna have you lift up, and I am listening to the mitral. All right, and then I'm gonna repeat that with the bell. All right, if I can have you lift up. All right, and I didn't hear any abnormal sounds or extra sounds. Everything sounded clear and consistent with its rhythm. Now we're gonna do the posterior chest. You almost get to lay down. Almost. Okay. All right, so I am looking at your... Yeah, that works. You know, just pull your hair over your shoulder too. All right, I am inspecting her chest for appearance, color, configuration, and symmetry. It's symmetrical, and I'm also looking at her spine. I'm just gonna like,
Oh, yeah.
I'm looking at her spine for any like dimples.
I have back fat.
Me too, girl. Irregularities of which I see neither. I'm also noting her effort and rate of breathing is with ease and non-labored. And I'm also going to palpate the bony structures, including her her scapula, ribs, and spine for any tenderness or bulges. Let me know if any of this hurts.
Okay.
Can she see me? Yes, she can. Yep, spine. All right, and then the ribs.
Mhm.
All right, I didn't feel any bulges. Did any of that hurt, Miss Patient?
No.
No. Oh, I get to auscultate again. Yay. All right, so I'm going to auscultate over the 10 spots for her lungs. I'm listening for lung clarity and the adventitious noises. All right, I'm going to have you breathe in.
Okay.
Wait, not yet. Yeah, she'd say. All right, breathe in. Breathe in. All right, I'm going to go under your brow just a little bit.
Okay.
Alrighty, I listened for her lungs. I didn't hear any adventitious noises. They sounded clear. Now I'm going to listen to her lateral lung sounds. There's 4 on the, wait, let me think. 4 on the right and then 3 on the left. And I'm listening for lung clarity and adventitious sounds again. Alright, so I'm so bad with my left and right.
This is the right.
Hurts on this side, so 4 on this one. Breathe in. You ever burn the house down with that?
I like fire sometimes. Like
All right, they sounded clear. I'm gonna do the other side now.
marshmallows. Like, you know. You made a. Did she made
I think the camera needs to
a.
see.
Yeah, that's what I was thinking.
Yeah, that works. I'm gonna lift your bra. Okay. Alrighty. Her lungs were clear. I did not hear any adventitious noises. You have to lay down.
Oh, heck yeah. Can I put this back on? Or not?
No, I'm gonna do your abdomen
Wait,
now.
can I put the blanket on?
You can put it in like your head or something, or like covering your legs.
Okay, I'm going.
Alright, while she's doing
Fully
that,
loaded.
I am inspecting for side to side symmetry,
Oh
contour,
yeah, she's good view.
movement, peristalsis, and pulsations. Her abdomen is flat. Oh my god, I'll fall over. I also looked at her skin for any skin characteristics like scars, lesions,
None.
bulges. I don't see any scarring. No bulges, no lesions. I'm also going to auscultate the 4 quadrants. I'm listening for bowel movements. I'm listening with the diaphragm, and I'll let you know what region I'm in. All right, I'm in the lower left quadrant. All right, I'm moving to the upper left. Alrighty, these 2 are the right ones. And I'm doing the upper left and the lower left. Alright, so I actually started with the right side. And now I'm going to auscultate the epigastric region with the bell, and I'm listening for the abdominal aortic bruit. And all of her regions were normal active. Alrighty, and I hear no bruit. And I auscultated the 4 regions, and now I'm going to palpate them. Does any of this hurt? And I'm also going to I'm going to palpate the umbilical area, which is around the belly button. Any of that hurt? Right, and I palpated no masses. All right, Miss Patient, I want to have you sit up. I'm sorry.
Also, I haven't checked my stomach, so sorry.
So now I am doing her legs.
Can I put this back on?
Yeah, I'm gonna look at your legs though.
Oh, that's one.
Oh, I'm sorry. All right, I am looking at her legs, ankles, and feet, and I'm looking at them for symmetry, deformities, and limitations of mobility. They look good. I'm gonna palpate them for temperature, moisture, texture, tenderness, and edema. Let me know if any of this hurts. Nope. Can we see this?
I'll do it like this here.
Oh yeah, that works. Alrighty, Alright, and there's no edema. I'm going to look at her nails for shape, contour, consistency, color, thickness, and cleanliness. Yes,
Also, you don't want to check all these.
her nails are clean, consistent, they have appropriate contour. I'm also going to check her capillary refill. Alright, less than 2 seconds for each nail. I'm also going to look at her heels for intactness or any lesions. None on that foot, none on this one. Now I'm going to palpate your joints during passive range of motion, and I'm looking for tenderness, limitations of movement, or crepitus. I'm going to do your hip, go up to the side.
Love this.
I'm going to bend your knee. I'm going to do your ankle, toes. Any of that hurt? I'm just going to repeat the same thing to her other side. Thank you, Miss Patient. Bend to the side, to your knee, to your ankle, and toes. Alright, I felt no crepitus. I'm going to have her do her active range of motion. I'm going to have you do all of that stuff again.
Side, back,
Knee, ankles,
knee,
toes,
ankle. Same, back, front,
side.
hip, ankles.
Any of that hurt?
No, but I hate
I'm
it.
also
I'm
gonna-
under.
I'm also gonna have you stand up because we're gonna do fun stuff. I'm gonna have you bend at your hips.
Is that it?
Bend your knees, and then just like a slight little dip in the knee. That works. All right, if you could stand up. I'm gonna have you bend at your hips one more time so I can assess your spine.
I would like this.
Yeah, so I'm looking at her spine. I'm looking for scoliosis, kyphosis, balance, and mobility, all of which look good. Let you sit down.
Yep.
Uno mas. And
Uno mas is a place you can eat if you don't.
That's also one more in Spanish.
One more.
All right, I'm gonna assess her muscular strength. Try to push up on my hands. Try not to let me pull you up.
Okay.
All right. Don't let me try to keep your legs where they are. Don't let me pull you or push you. Oh, no, to keep them bent. Okay, try not to let me push. Try not to let me pull. All right.
Your
Try.
back is too big.
Okay. Try to flex. Try to point. All right. By about a 5 on all of her muscles. And now I'm going to palpate your posterior tibialis and your dorsal pedis. You can lean back for this one if you want. Put your feet up. I am looking for presence, amplitude, equality, and regularity. So her anterior, I always think anterior is posterior tibialis. It is present with the +2 and it occurs on each side at the same time. and are your dorsal pedal.
Whatever.
It occurs on each side at the same time with a +2 amplitude.
I do believe that is it. Yes, ma'am.
The video, 'cause
Yeah.
it's a lot.